Good, happy Friday morning, March 11, 2022. I'm Riley King. Welcome to this Friday morning edition of your morning news update right here on the Riley King Radio Network. We have a lot of news to get to this Friday morning, so let's get started right now. First up, civil claims against former state trooper accused of beating chase suspect settled. Let's take a listen to that video from WMUR News 9.
A former New Hampshire state trooper who pled guilty to assaulting a man following a chase has now settled with that driver. Andrew Monaco, has seen here in an aerial video, hitting Richard Simone. The 2016 case started in Massachusetts but ended in the city of Nashua. The civil settlement between Monaco and Simone is referenced in a court filing for the Massachusetts state trooper, also seen during that beating. Details of the agreement are not in the filing.
Okay, and there you go on that video and that report. Massachusetts changes COVID-19 death definition. New Hampshire continues its own criteria. Let's take a listen to that video from WMUR News 9.
It's time for new ways to manage CO2 emissions. As a trusted partner, Lindy helps you explore all the possibilities for creating beneficial.
An interesting policy change to tell you about down in the Bay State tonight. Total COVID-19 deaths in Massachusetts are dropping by 15% because the state is changing its criteria. Now, the Bay State still including anyone who had COVID listed as a direct cause of death on their death certificate. Also, anyone who had a COVID diagnosis 30 days before their death are now counted. That used to be, though, a 60-day window. The change means that COVID deaths in the state will drop by 3,700, or about 15%.
Over time, our approach proved to be too expansive and led to a significant overcount of deaths in Massachusetts. People who had gotten COVID earlier in 2020 and died for other reasons ended up still being included in COVID-associated death counts.
So we asked the New Hampshire DHHS how it classifies COVID deaths. Its criteria is tighter. Only cases where someone tested positive for COVID-19 and it is listed as a direct or contributing cause of death on the death certificate is counted. So someone with COVID-19 who died from an unrelated cause is not included in the New Hampshire total.
Okay, and there you go on that video and that report. Governor Sununu back tax cuts on gas and other items. Let's take a listen to that video from WMUR News 9.
Governor Chris Sununu in favor of cutting the state's gas and other taxes because of inflation. He talked about it during a New England Council event this morning.
The legislature today wanted to propose a gas tax cut. I am on it. They want to cut room and meals tax. I am on it. Something might be temporary, but something just to spur what's happening.
While the governor did say that the invasion of Ukraine has made things worse, he says inflation was already a problem because of policies put in place by Washington.
Okay, and there you go on that video and that report. Medications to treat COVID-19 now available in New Hampshire. Let's take a listen to that video from WMUR News 9.
They're readily available across New Hampshire. Antiviral pills intended to treat mild to moderate symptoms of COVID-19 and prevent severe disease.
These are still medications that are under FDA's emergency use authorization. So there are still requirements for how and when to prescribe these.
Two kinds of medications are on shelves at more than 100 pharmacies statewide. Patients must have a prescription to get them.
There are some requirements, like there needs to be some clinical assessment, as we've mentioned, right? What other medications is this person on? There needs to be some communication with the patient.
State epidemiologist Dr. Benjamin Chan says Pfizer's Paxlovid pill is the more effective of the two, but it's limited in supply. It's expected to be at most Walgreens locations over the next 2 weeks. Dr. Chan says there is more supply of the less effective medication, Merck's Molnupiravir. That can be found at Walgreens, CVS, and Rite Aid stores, but Dr. Chan warns it should be avoided during pregnancy. A federal program will also be bringing more of the medications to CVS Minute Clinics.
This has always been the goal, to get these medications through normal healthcare distribution mechanisms.
State officials say the medications should be free because the federal government is requiring them. And if you'd like to see a full list of where they are available in New Hampshire, you can visit the story on our website or mobile app. Reporting live in Manchester tonight, Mike Cronin, WMUR News 9.
Save big.
Okay, there you go on that video and that report. Mammoth tooth auctioned off to raise money for Ukraine. Let's take a listen to that video from WMUR News 9.
Using tax filing software. Smart.
No.
A mammoth tooth found by fishermen off the coast of Newburyport, Massachusetts, being auctioned off to help feed people fleeing Ukraine.
It is now up on eBay, and the money will go to support World Central Kitchen. Will Clyde from UNH helped identify the tooth.
Mastodons and mammoths, are close cousins to elephants today, and so big animals. And they were wandering around this area up to about 10 to 12,000 years ago. And at that time, sea level was a lot lower. It's during the very end of the last ice age. And so that area that is now covered with water was land.
The auction ends Sunday. We have a link on the WMUR website and our mobile app.
Learn something every day.
Yeah, that is one mammoth tooth.
It is big.
Okay, there you go on that video and that report. And that does it for this morning news update right here on the Riley King Radio Network. Thank you for tuning in and listening. Have a great day, everyone. Goodbye.